Our population is getting younger in terms of who is getting hip replacements. People are no longer willing to be inactive for a while, waiting until they're 60 or older in order to get their total joint, which is usually what's recommended. So our active lifestyles, our rates of obesity, the injuries that people are getting, that is causing us to see more and more people who are younger requiring total hip replacements. And total hip replacements have been a very successful procedure in our country, and it still remains the gold standard for arthritis. The problems with total hip replacements are it traditionally has been done for people who are older, and so total hip replacements do not last forever. We would expect 10 to 30 years now, and then we would have to redo the total hip replacements for a variety of reasons. When we redo the hip replacement, the outcomes are not as good as when we do the first one. It is that second or third operation that really gives us a problem. The first total hip replacement is wonderful almost across the board on average. So that leads us to where we are right now with total hip resurfacing. If you have a person who is in their 40s and 15 years from now they need a second operation, 55 is still very young. And so that is not a very good time to have a less than perfect outcome. That's really what leads me mostly to doing surface replacements, is it's the next operations. The main difference between that and a total hip replacement is that on the femur side, on your thigh bone side, there is more preservation of the bone. So we take just a very small rim of bone from the top of your thigh bone, and then we place a metal cap onto that, leaving almost all of the bone remaining on your thigh bone. And then we mate that to the socket on the other side, which is either a cobalt chrome or a titanium shell, which we've placed inside of the socket. If we have to redo the hip, then all we need to do is take off that cap and treat it just like a regular total hip. And the results from that is like starting from day one doing the total hip replacement. So that really is the true advantage. It's more active patients, and your revision is almost that of a regular primary total hip result.